Welcome back to You Ask Doc About Menopause. This is part 2 of our YouTube series on menopause, a condition that impacts all women eventually. In part 1, we reviewed the symptoms of menopause and considerations for hysterectomy and PCOS. In this video, we dive further into menopause, specifically hot flashes, bone health, and how menopause can affect your heart. If you have not done it yet, as you watch this video, hit like below and subscribe to our YouTube channel so you can view all our other YouTube videos.
What are hot flashes? Are they the same as night sweats?
So this is a common one that I'm asked. Both hot flashes and night sweats cause feelings of intense heat and sweating. Night sweats are simply hot flashes that occur during sleep. That's the main difference, the timing of it. Both are common during menopause and are very disruptive to the daily life and sleep patterns of a woman. Hot flashes, right? They're a sudden feeling of warmth, often rising up from the neck, the chest area into the face area. This can be accompanied by sweating, and it can last anywhere from a few seconds to several minutes and can occur at any point throughout your day. Night sweats are hot flashes that happen at night, as I just said. So these can lead to waking up feeling drenched in sweat, feeling fatigued. I'll be honest, when it happens, you actually wake up feeling cold because you just sweat. And oftentimes, like let's say you have an AC on in the bedroom, it's just a whole mess. But these can, as you can imagine, disrupt sleep and negatively impact your quality of life because after not sleeping, you still have to function during the day. Fluctuations in estrogen levels can affect the body's ability to regulate its temperature, leading to these symptoms. Other potential causes should be ruled out, such as hormonal disorders like a thyroid disorder or Cushing syndrome when there's abnormal cortisol levels, as well as medications, because some medications do cause hot flashes as a side effect, including some antidepressants, which funny enough, I'm going to speak about later in another part of the series. Blood pressure medications can cause hot flashes. Opioid medications and pain medications can make you feel flushed. Cancer treatments and hormones, even the birth control pill can do this as well. And medications that might be prescribed to treat osteoporosis or low bone density.
How can I prevent hot flashes?
How can you prevent hot flashes? So, okay, there are various management strategies for managing hot flashes and night sweats. Always start simple, right? So lifestyle changes. You want to stay cool as best possible. Start learning which materials breathe better in terms of your environment and the things you can control, right? Because these hot flashes, these sweats are a bit out of your control. So the things you can control, it might be like the materials you wear, the bedding that you're using for sleep. Avoid triggers, and with triggers, you may have to sort of observe and see what situations make it more likely to have an episode of sweats as well, too. And review the medical treatments you might be on with your doctor. Before considering medication, you can try to make lifestyle changes, but hormonal therapy can be considered lifestyle changes are not enough. With the hot flashes and the night sweats, remember I mentioned it's a inability to regulate your body temp. So this is where staying cool, dressing in layers, you can, take your layer off, put your layer on, allow you to find comfort quickly. If you start to feel warm, you were better off keeping a small fan, right? Electric fan or just a small fan available just to help cool yourself down rapidly when there is a episode of sweats. Keep your environment cool as well. Use the fans, the AC, open your window, lower the room temp as best possible. Take cool showers, cold beverages, cold drinks, hydrate. Sips of cold water throughout the day can help cool you down from the inside. I always think about menopause in terms of the fact that my grandmother, may she rest in peace, and today's her birthday as we record this. When you think of our grandmothers and even their moms, they had menopause, right? but they would dress a certain way. They would be sipping on a cool ice beverage as well too. They'd have the fan on and make their adjustments to feel more comfortable throughout the day. So sips of a cool beverage can help cool you down from the inside. Cool down before bed. Lower your bedroom temperature. Consider a cooling pillow because they have those options now. And always keep a small amount of cold water at your bedside. Sip some before you head to sleep as well too. You should start to register and learn what might make your menopause symptoms worse. Of course, it depends on your symptoms, but for example, if hot flashes and sweating are your main symptoms, you may want to stop eating spicy foods. Don't kill me. But you may want to dial back on the pepper sauce because maybe that's one of your triggers. If you have symptoms like anxiety or insomnia, you may find that relaxing activities like yoga or reading before bed, reduce the use of electronics before bed, help calm your mind, and lead to more peaceful sleep as well too. Keep a journal, right? That's another thing I would recommend in terms of managing symptoms, just to avoid missing triggers that you could really learn to sort of reduce your symptoms. So some women find keeping a journal of symptoms helps them identify what may be causing these symptoms to worsen, not what causes the symptoms, but what makes it worse. Then they can take steps to avoid certain activities and reduce symptoms just by that. So you might track your hot flashes, identify potential triggers. It could be caffeine. I just mentioned the pepper sauce, the spicy foods. Alcohol is a big one. Don't shoot me, but dial back on the Prosecco and those things. Reduce your stress. Stress is always on the list. And those are the things that no doctor can fix for you, right? So limit or avoiding your triggers. And once identified, you can try to minimize things that will actually be causing higher likelihood of symptoms. Practice the yoga, meditation, deep breathing, and so forth. Engage in mindful practice, which sounds heavy, but it's quite simple to just be more aware of your body and your emotions, which can help manage stress and hot flashes. And what do I mean by that? So sometimes I would have had patients come in at their wits' end, quite frazzled, over it completely with menopause and their menopausal symptoms. But as we talk through what's going on, they're actually physically pretty good most times, but it might be a situation of high stress at work, or it might be time for a new job, relationship stress, and those things that you may have been tolerating all along in your 30s. As you get into your 40s, mid 40s, and late 40s into your 50s, your level of tolerance might understandably be much smaller for situations that have been quite stressful to you. So, in terms of mindfulness and mindful practice, what I think is very helpful is to just continuously take stock of yourself. Do a check in, and just like I recommend coming in for checkups, you can check in with yourself and just sort of gauge where you are, where you feel more stable in terms of the situations in your life. Right? So, hopefully, that makes sense to you. Another thing to do is lose weight. We can lose weight. If you're overweight, studies suggest that losing weight can help reduce the frequency and severity of hot flashes. Regular exercise is another one. Physical activity, especially moderate intensity exercises like walking, can help manage weight and reduce the frequency of your hot flashes. I also usually recommend, I didn't find much data on it, but I do know from when I learned about this since medical school that even water-based activities help you with hot flashes as well too, including like a swim aerobics class, or heading to the beach as often as you can. Maybe you have a pool or you have a friend with a pool, but if you suffer with intense hot flashes, water-based activities has been found to be quite useful as well too. For my smokers out there, quit smoking. Smoking is linked to more frequent and severe hot flashes and more reduced predictability in your body's ability to control its temperature, right? So stay hydrated is another one too, and drink plenty of water throughout the day.
Does menopause cause bone loss?
So the answer for this one is yes, absolutely. Menopause can cause significant bone loss, increasing the risk of a woman's osteoporosis, developing osteoporosis, and a woman getting bone fractures. The drop in estrogen levels during menopause disrupts the delicate balance between bone breakdown and bone rebuilding. So this leads to a net loss of bone mass. Um, Estrogen plays a crucial role, right, in maintaining bone strength and bone density. During menopause, low estrogen production accelerates the bone loss with increased resorption or breakdown of bone compared to bone formation. And usually we're sort of always in balance where as we break down bone, we build it back up. So this is disordered, which results in decreased bone mass. So osteoporosis is when your bones become weak and brittle, making them more prone to fractures, and it can be quite serious, but it's preventable, it's avoidable. Women who experience early menopause, as I said, age 40 or younger, a woman who have surgical menopause where the ovaries are surgically removed prior to the onset of actual menopause, especially at a younger age, are more at risk for bone density loss, and HRT can be prescribed in these cases. Women who enter menopause around the natural age of about age 51, well, now we learned in the Caribbean it can be as young as 49.6, but these women may experience significant bone density loss within 15 years in postmenopause. So that's why we start doing bone scans, or what we call DEXA bone scans, bone densimetry, the bone densimetry scans, to look for osteopenia and osteoporosis. And we usually start that around age 63 to 65, or at least within 10 to 15 years from when the last period may have been, as long as there are no other risk factors for osteoporosis. Low calcium and vitamin D intake, cigarette smoking, excessive alcohol consumption, don't come for me, and a sedentary lifestyle can contribute to bone loss. So those all combined with menopause does put you more at risk. While menopause is inevitable as we age, bone loss can be prevented with a balanced diet rich in calcium, vitamin D supplements, and regular weight-bearing exercise.
Does menopause increase risk of heart disease?
So technically, menopause doesn't cause heart disease, but it can increase the risk due to hormonal changes and other body changes that can negatively affect your cardiac health, right? Does that answer make sense? So it doesn't directly cause heart disease, but it could increase your risk. Your risk could be increased because of your lower estrogen levels. So some studies have shown that women who experience menopause, especially early menopause, are at higher risk of developing heart disease compared to women of the same age who have not yet reached menopause. Specifically, the decline in estrogen levels can affect our blood vessels, blood pressure, cholesterol levels, and other factors that increase heart disease. Estrogen, which is our female sex hormone, I've said it a million times in this series now, it plays a protective role in the cardiovascular system by helping to keep our blood vessels relaxed and open, right? So it helps in terms of that circulation, and also helps to maintain healthy cholesterol levels. During menopause, estrogen levels will naturally decline, which therefore indirectly leads to an increased risk for heart disease. Besides hormonal changes, menopause can lead to other changes that can promote heart disease, such as stiffening and weakening of blood vessels as we age, which contributes to high blood pressure, which of course also has a genetic component to it for most of us. High cholesterol, similarly, right? So increased risk of heart disease there. Changes in our body weight and our fat stores, increased body fat, especially since menopause, yes, it's not classified as a symptom, but we, in our perimenopausal phase, tend to store fat around the midsection, right? And that's linked to increased risk of heart disease as well too. So that was part 2 of our series. And again, we're doing a mini series on menopause, and hopefully you are enjoying the series so far. Stay tuned for part 3. Free to leave any questions or compliments in the comments. Like this video and subscribe to our YouTube channel. You can also book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealthtt.com.